In selecting heifers based on a reproductive efficiency, an examination on the heifers by veterinarians can be determination of the reproductive tract scores. So in selecting heifers at purchase or raising heifers and selecting some heifers out of a group for replacement heifers, doing this at about 12 months of age, a rectal palpation needs to be performed by a veterinarian on these heifers. And in that rectal palpation, reproductive tract score would be determined. And this can be done by hand palpation, where the veterinarian will pick up the two horns of the uterus and evaluate the tone and the size of the two horns. The higher the diameter in millimeters, as well as the increase in the tone of the horns of the uterus, will increase the grade on that heifer. So there's a grading score of 1 to 5, where 1 would be a heifer that has no tone to the two horns of the uterus, and the diameter of the horns would be less than 1 inch in diameter. So as a veterinarian determines that the diameter is less than 1 inch and there's no tone, then that's going to be classified as a grade 1. If there's a little bit larger size but yet no tone, you classify it as a score of 2. So those heifers that get graded as a reproductive score of a 1 or 2 should be culled and not used for replacement heifers, because tone is needed in the horns of the uterus for them to be healthy. The veterinarian says they just feel dead, they just feel like wet noodles, they're small in diameter, they're 1s and 2s. But then the 3s are a little bit larger in diameter, getting closer to the inch or a little over in diameter. There's a slight tone to the two horns, so now that would be a score of a 3. So those are possible keepers. But then the 4s and 5s would be well over 1 inch in diameter of each of the two horns, as well as active tone to the two horns, and those are the keepers. In addition to palpating the two horns, the two ovaries then can be palpated, and by feel they can be by judgment measured, or even more accurately, the veterinarian can take in with their hand a wand to an ultrasound and lay the wand to that ultrasound on the ovary, and then look at the monitor on the screen and see a digital image of that ovary, and using the ruler on the monitor actually measure the ovaries in diameter or in thickness, as well as the height, as well as the length. And then using a scale, those ovaries that are real short, that are not very tall and not very thick, they get graded as a 1 or 2. Those that are getting a little bit closer to 1 inch in length and a little more thick, then they get graded as a 3. And the 3s are a little bit iffies, but the 1s and 2s would be culls, and then maybe some other good characteristics might keep a 3. But the true keepers would be the 4s and the 5s, that the heifers will cycle early, they will ovulate a healthy egg, and for fertilization when they have that tone and have that large active size. A lot of heifers that are 12 months of age are not mature enough for breeding. They may not be mature enough till they're 24 months, and economically we cannot keep those heifers. So before selecting heifers for breeding is to do these reproductive tract scores. That can even be taught to the producers by the veterinarians to be assured that we're doing those scoring on those heifers at the time of selection.